Welcome to the deep dive. Today we're digging into something pretty common for dog and cat lovers: eye ulcers. The medical term is ulcerative keratitis.
Right. We've gone through the research to sort of pull out the key info on this. It can be quite serious.
Exactly. So if you've ever seen that, red or cloudy eye on your pet and wondered, or if you just want to be prepared, this should really help clarify things.
Give you a clearer picture of what's actually happening.
So let's just jump right in. What is ulcerative keratitis exactly? What are we talking about?
Okay, so picture the cornea. That's the clear sort of dome at the very front of the eye.
The window.
Yeah, exactly, the window. Ulcerative keratitis is when that window gets inflamed and it loses some of its layers. It might just be the very top surface layer, the epithelium.
Okay.
Or it can go deeper into the main supporting tissue, which we call the stroma.
Right. So it sounds like there's quite a difference there between maybe just a surface scratch and something, well, more significant.
Oh, absolutely. A huge difference. We tend to classify them first by depth, superficial versus deep. Superficial is just that outer layer, like you said, a scratch. Usually heals faster. A deep ulcer goes into that stroma, and that's, much more worrying because you're getting closer to potentially rupturing the eye.
Wow. Okay.
And then we also talk about uncomplicated versus complicated ulcers. Uncomplicated ones, they tend to heal okay if you treat them right.
Makes sense.
But complicated ones, well, they have other things going on that stop the healing, like an infection or sometimes these enzymes.
Enzymes. What do enzymes do?
Yeah, well, especially in those deeper ulcers, if bacteria or sometimes fungi get in there, they can release these enzymes that basically start dissolving the cornea.
Dissolving, seriously?
Yeah, we actually call them melting ulcers or molassic ulcers. The cornea can look really soft, almost like jelly. It's quite alarming to see.
Okay.
Whereas, a simple superficial scrape, that epithelium, it can heal up in just a few days. But stromal damage, that takes weeks, and it often leaves a scar.
Okay.
And sometimes, even after a deep one heals over on the surface, there's still a thin spot underneath. We call that a facet.
That really clarifies it.
Yeah.
Definitely not always a minor thing. So, all right, what causes this? What usually kicks off ulcerative keratitis?
Well, there's quite a list of potential causes. Probably the most common is simple trauma.
Like getting scratched.
Exactly. A cat scratch, bumping into something sharp, running through bushes, that kind of thing.
Hey.
Then you've got problems with the eyelids or eyelashes, what we call adnexal issues. Things like eyelashes growing the wrong way towards the eye, or eyelids that roll inwards, that's entropion. Basically anything that causes constant rubbing on the cornea.
Like having something stuck in your eye constantly.
Precisely. Then there's the inability to blink properly or close the eyelids fully. That's called lagophthalmos.
Ah, I've heard of that.
Yeah, you see it a lot in those breeds with the flatter faces and the big prominent eyes.
Brachycephalics, like pugs.
Exactly. Pugs, bulldogs, shih tzus. Their eyelids sometimes just physically can't cover the whole eye surface. Or it can happen if the eye is bulging for another reason, or even nerve damage affecting the eyelid muscles.
Okay. What else?
Tear film problems are a big one. Either not enough tears, that's dry eye, or KCS, keratoconjunctivitis sicca,
Right.
or the quality of the tears isn't right. Tears have protective stuff in them, so if they're deficient, the cornea is just much more vulnerable to damage.
So it's not always a direct hit. Sometimes it's just the defenses are down.
That's a great way to put it, yes. Infections can also be a cause, but interestingly in dogs, infection is often secondary, meaning something else damages the cornea first and then bacteria jump in. In cats, though, it's a bit different. Feline herpes virus is a very common primary cause of ulcers in cats.
Herpes virus, like cold sores in people?
Sort of analogous, yes. It causes respiratory issues too, but it loves the cornea. And speaking of cats, certain breeds, Persians, Himalayans, sometimes Siamese and Burmese, they're prone to getting these things called corneal sequestrums.
Sequestrums.
Yeah, it's like a little piece of dead corneal tissue. It often looks like a dark brown or black spot, and it can cause chronic irritation and ulceration around it.
Huh. Interesting.
Then there are some primary diseases of the cornea itself, like dystrophies that make it inherently weaker. You see those in certain breeds too, like Shetland sheepdogs, Boston Terriers.
Right.
And finally, there's sort of a miscellaneous category, things like foreign bodies getting lodged under the eyelid, chemical burns, nerve damage affecting corneal sensation, even immune system problems attacking the cornea.
Wow, okay. That is a long list. So I guess the question is, how common is this? Is it something most owners will face?
It's definitely a common condition, yeah, in both dogs and cats. And we absolutely see those breed predispositions playing out.
Like the flat-faced dogs you mentioned.
Exactly. Brachycephalic dogs are just sort of set up for trouble because of their eye shape, more exposure, maybe that lag ophthalmos we talked about. They're just more likely to get trauma or drawing.
Makes sense.
And then there's a specific type of superficial ulcer, the slow-healing ones, called SCCEDs, spontaneous chronic corneal epithelial defects, or sometimes indolent ulcers.
Okay.
Any dog breed can get those, but we tend to see them more in middle-aged or older dogs. Boxers are kind of famous for them, unfortunately.
Ah.
And for cats, as we said, those breeds like Persians and Himalayans are definitely at higher risk for the sequestrums, which often lead to ulcers. So the age really varies depending on the cause, you know? A young dog might get a traumatic ulcer. An older dog might develop an SCCED.
Right, right. Okay, so if you're at home worried about your dog or cat, what are the sort of red flags? What should you be looking for?
Well, the common signs owners usually notice first are things like increased tearing or watery eyes. Squinting is a big one, or blinking a lot.
That suggests pain, right?
Absolutely. Pain or irritation. Pawing or rubbing at the eye is another sign. You might see the eye looking cloudy or even bluish. That's usually swelling in the cornea called edema. And sometimes that third eyelid, the little membrane in the corner, might be protruding, covering part of the eye.
Right, the nictitating membrane.
Exactly. And specifically for cats with herpes virus, you might remember them having, say, sneezing fits or a runny nose recently or concurrently.
Okay, and then when you get to the vet, what does the vet actually see during the exam?
Well, on the general look, the vet will probably see some of those things too. Maybe discharge, which could be clear, or maybe thick and goopy, yellow or green if there's infection. Definitely the squinting, maybe redness in the white part of the eye. But then looking closely at the cornea itself, depending on the ulcer type, a superficial one might just look like a subtle dull spot or irregularity.
Harder to see, maybe.
Can be, yeah.
Yeah.
Deeper ulcers often look like actual divots or craters in the cornea. If it's been there a while or it's trying to heal, you might see tiny red blood vessels growing onto the clear cornea. That's neovascularization. Sometimes pigment, like brown spots, can start to appear as part of chronic inflammation or healing. And then those melting ulcers. They really do look kind of gooey or gelatinous.
Grim. And what about those SCCEDs you mentioned? Do they look different?
Yes, they often have a characteristic look. The edges of the ulcerated area, that top epithelial layer, often look kind of loose, maybe slightly rolled or unattached.
Ah, okay.
And the key diagnostic feature often comes with the stain, which we'll talk about, but visually it's that loose edge. And one other thing we often see alongside ulcers is inflammation inside the eye.
Inside.
Yeah, it's called reflex anterior uveitis. The ulcer triggers inflammation deeper inside. You might see the pupil get small, the iris might look a bit muddy or dull. And if there's a bad bacterial infection, especially with the deep ulcer, you can sometimes even see pus layered in the bottom of the front chamber of the eye. That's called hypopyon.
Wow. So diagnosis sounds really key to figuring out what's going on. How do vets actually confirm it is an ulcer and, what type?
Yeah, the absolute workhorse diagnostic tool is the fluorescein stain.
That orange dye.
That's the one. It's a special dye that doesn't stick to the healthy, intact surface of the cornea, the epithelium, because that layer is kind of fatty or lipid-loving. But the layer underneath, the stroma, is watery or water-loving.
Okay.
So if the epithelium is missing, like in an ulcer, the watery stroma underneath soaks up that orange dye, and it glows bright green under a special blue light.
Cool. So it highlights the defect.
Exactly. And the pattern of staining tells us a lot. A simple patch of stain suggests a superficial or maybe a stromal ulcer. The shape might even give clues, like a thin line could suggest a cat scratch.
Right.
With those SCCEDs, the key is that the stain often spreads under the loose epithelial edges, creating this kind of halo effect beyond the main defect.
Because it's not stuck down properly.
Precisely. And then there's a really critical pattern. If you see a ring of stain, but the very center of the deep hole doesn't stain.
Why wouldn't it stay?
Because you're down to the very last, deepest layer of the cornea called Descemet's membrane. And that layer, like the epithelium, repels the stain. That's a Descemet.
That sounds bad.
It's extremely bad. It means the eye is literally one thin membrane away from rupturing. It's a surgical emergency.
Yikes.
And then there's the facet, that healed over thin spot. It might pick up a tiny bit of stain right at first, but it washes away really easily because the epithelium has covered it, even though it's thin.
So that stain gives a ton of information. Are there other tests vets might run?
Oh, yes. Especially if the ulcer looks deep or if it's getting worse rapidly or maybe just not healing like it should,
Yeah.
then doing a corneal culture and sensitivity is really important.
To check for bugs.
Exactly. We take a little sterile swab sample from the ulcer bed before putting any more meds in, send it to the lab to see if bacteria or fungi grow, and crucially, which antibiotics or antifungals will kill them.
Makes sense.
For cats, if we suspect herpes virus, we might scrape some cells for PCR or IFA testing to look for the virus itself. Though a negative test doesn't completely rule it out, unfortunately.
Mm.
We can also do cytology right there in the clinic. Gently scrape some cells, stain them, look under the microscope. Sometimes you can see bacteria or fungal elements or characteristic inflammatory cells.
Okay.
In cats, another stain called rose bengal can sometimes be helpful. It tends to stick to devitalized cells in mucus, and it can highlight those very fine branching ulcers, dendritic ulcers, which are really typical for herpes.
Right.
And of course, if we suspect dry eye as part of the problem, we'll measure tear production with the Schirmer tear test strips. Although you have to be a bit careful putting anything in the eye if it looks really deep and fragile.
Got it. Okay, so we've got a handle on what it is, the causes, who gets it, the signs, how it's diagnosed. Let's move to the really crucial part, treatment. How do you manage ulcerative keratitis?
Right. And the first thing to say is treatment absolutely depends on the cause and the severity. There's no one size fits all. But some basics apply to most cases. Good nursing care at home is vital. Gently cleaning away any discharge. Maybe keeping hair trimmed away from the eyes.
Makes sense.
Activity restriction is usually recommended, especially for deeper ulcers. You don't want them roughhousing and risking bumping the eye.
Right.
And the dreaded Elizabethan collar.
The cone of shame.
The cone of shame. It's almost always essential. Pets will rub or paw at an uncomfortable eye, and that can make things so much worse or even cause a rupture. So the cone stays on.
Non-negotiable, basically.
Pretty much. Client education is also huge.
Right.
If you're prescribed multiple eye meds, understanding the timing is critical. You generally need to wait at least 5 minutes between different eye drops.
Okay.
And maybe even longer, like 10-15 minutes if you're putting an ointment in after a drop, so the drop has time to absorb first.
Right. That's important.
And knowing what signs mean, things are getting worse, more redness, more squinting, change in discharge, the eye looking cloudier, and when to call the vet back immediately. Also, setting expectations. Especially for those SCCEDs, owners need to understand it can be a long haul, sometimes requiring multiple vet visits and procedures. It's a marathon, not a sprint.
Okay. What about surgery? You mentioned if for descemetosceles, but is it common otherwise?
Well, for uncomplicated superficial ulcers, if you remove the cause, like ingrown eyelash, and treat with meds, they usually heal without surgery.
Right.
But yes, if an ulcer gets deep, say, more than 50% through the stroma, or definitely if it's a descemetoscele or an actual perforation, surgery is often the best and sometimes the only option. It becomes an emergency.
Right.
For those stubborn SCCEs that just won't heal with meds, we have several procedures. Simple debridement is often the first step, using a sterile cotton swab to gently remove that loose, non-adherent epithelium.
Trying to get it to stick down better.
Exactly. If that doesn't work, we might move to something like a keratotomy. That could be a grid keratotomy, making little crosshatch scratches, or punctate, making tiny dots, or using a special diamond burr tool to sort of roughen the surface underneath.
All aiming for better adhesion.
Correct. These techniques aim to break through that abnormal layer that's preventing the epithelium from sticking. A more involved option is a superficial keratectomy, where we surgically remove a very thin layer of the superficial stroma. That has a very high success rate for SCCEDs, but it's more invasive.
Okay.
Sometimes after these procedures, we might place a soft bandage contact lens on the eye or do a temporary third eyelid flap just to protect the cornea while it heals.
And for the really deep ones.
For deep ulcers or perforations, we need to provide structural support and blood supply. A conjunctival flap is very common, taking a piece of the conjunctiva, that pink tissue lining the eyelids, and stitching it over the defect.
Like a patch.
Exactly, a living patch that brings blood vessels. Other options exist too, like transposing a piece of cornea from elsewhere, corneal transplants, or even using a special tissue glue, cyanoacrylate, for very deep ulcers or tiny leaks.
Wow, quite a range of options.
Okay.
Now, medications. What are the go-to meds?
Meds are critical. Topical antibiotics are used in pretty much all ulcers to prevent or treat bacterial infection because even a sterile ulcer is vulnerable.
Right, which ones?
For simple superficial ulcers, a broad-spectrum antibiotic ointment applied maybe 3 or 4 times a day might be enough. Things like triple antibiotic ointment, neomycin, polymyxin, B-bacitracin, or maybe erythromycin, especially in cats.
Okay.
But for deep, complicated, or infected ulcers, especially those melting ones, we need more aggressive therapy. Often that means fortified antibiotics specially prepared, stronger concentrations or specific combinations, maybe cephalosporin like cefazolin combined with an aminoglycoside like tobramycin, or fluoroquinolone like afloxacin or ciprofloxacin. And these might need to be applied really frequently, like every 1-2 hours at first. It can be. Then, for the pain and that internal inflammation, the uveitis, we often use topical atropine. It dilates the pupil, which helps relieve the spasm and pain.
Okay.
If it's a cat with herpes virus, then topical antiviral medication is key, something like trifluridine or cidofovir. And for pain and inflammation systemically, especially in dogs, we might use oral NSAIDs, non-steroidal anti-inflammatories.
Got it. Are there any medications that are a definite no-no for ulcers?
Absolutely. The big one is topical corticosteroids, steroid eye drops or ointments.
Why not?
They suppress the immune response and healing, they can encourage infection, and they can actually worsen melting ulcers dramatically. So never use steroids on an ulcer unless maybe it's completely healed and there's some residual inflammation underneath that needs treating. But that's a very specific situation managed by a vet.
Okay. Crucial point.
Yeah.
Anything else?
Topical NSAIDs need caution too. While oral NSAIDs can be helpful for pain, topical ones applied directly can sometimes delay epithelial healing and potentially worsen melting in some cases, or be problematic with herpes. Also, atropine should be avoided if the pet has glaucoma or severe dry eye. And just practically, some antibiotic combinations can inactivate each other if mixed, and some drops sting more than others. Oh, but one thing that can often be used safely alongside antibiotics in uncomplicated ulcers, if dry eye is also present, is topical cyclosporine or tacrolimus to stimulate tears.
Okay. And for those really scary melting ulcers, anything specific?
Yes, besides aggressive antibiotics, we often add medications aimed at stopping the melting process itself. These are anti-collagen agents. Acetylcysteine is one, though its effectiveness is debated. A very common approach is using autologous serum.
What's that?
It's serum prepared from the patient's own blood. We spin down a blood sample, take the clear serum part, and dilute it to make eye drops.
Why does that help?
Because serum naturally contains antiprotease enzymes that can counteract the destructive enzymes causing the melting. It needs to be applied very frequently, often hourly at first, and it has to be kept refrigerated and remade every few days. So it's intensive, but can be very helpful.
This is definitely a lot for owners to manage. What's the follow-up like? And what's the general outlook?
Follow-up frequency really depends on severity. A simple superficial ulcer might just need a recheck in 3-7 days to stain it again and confirm healing. If it's not healed by then, we start thinking about underlying causes, or maybe an SCCED,
Right.
deep ulcers, infected ulcers, melting ulcers. Those need very close monitoring, sometimes daily initially. As things improve, the vet will start spacing out the medication frequency and the rechecks.
And prevention. Anything owners can do.
For those predisposed breeds, like brachycephalics, using lubricating ointments regularly can help protect the cornea. Sometimes surgery to slightly close the eyelid opening, medial canthoplasty, is recommended. If a pet has KCS, dry eye, lifelong treatment with tear stimulants like cyclosporine is crucial. For cats prone to herpes flare-ups, some vets recommend daily leucine supplements. Though evidence is mixed, it might help reduce severity or frequency for some individuals.
Okay. What happens if treatment doesn't work or isn't sought? What are the potential complications?
Unfortunately, they can be severe. The ulcer can keep progressing deeper, leading to rupture of the globe, the eyeball bursting.
Oh.
Infection can spread inside the eye, causing endophthalmitis. Scarring can obstruct vision. Chronic inflammation can lead to secondary glaucoma, which is high pressure inside the eye, very painful and damaging. Ultimately, complications can lead to permanent blindness, a shrunken, non-functional eye, phthisis bulbi, or a persistently painful eye that requires surgical removal and enucleation.
That really underscores the seriousness. So what's the bottom line on prognosis?
For uncomplicated superficial ulcers, prognosis is generally excellent. They usually heal quickly with appropriate treatment.
Good to hear.
SCCEDs have a good prognosis for eventual healing, but it can be a long and sometimes frustrating process, often needing multiple treatments over weeks or even months.
Okay.
Deep ulcers, especially if treated only medically, have a more guarded prognosis. They take a long time to heal, scarring is likely, and the risk of rupture is always there until fully healed. However,
Yes.
if deep ulcers are treated surgically, often with something like a conjunctival flap, the prognosis for saving the eye and achieving a comfortable visual, though possibly scarred eye, is often much better. The flap provides immediate support and blood supply, which dramatically speeds up healing and reduces pain relatively quickly.
That's a really important distinction. Okay,
Uh-huh.
let's try and summarize the key takeaways then. Ulcerative keratitis, common in dogs and cats, lots of different causes.
Right, from trauma to infections to breed issues.
Getting the right diagnosis,
Mm.
using that fluorescein stain, is step one.
Crucial. And tailoring the treatment meds, maybe surgery, definitely the pone, to the specific type and severity.
And acting early, being aware of those potential complications, seems really vital for a good outcome.
Absolutely. Early and appropriate intervention makes a huge difference.
Hopefully this deep dive gives people a much better understanding now.
Yeah, knowing the basics helps you know when to worry and what questions to ask your vet. It empowers you as an owner.
Definitely. This has been incredibly insightful. It really highlights how intricate and delicate the eye's protective systems are, and how easily things like eyelid shape or tear quality can disrupt that balance and lead to significant problems like these ulcers.
It's a fine balance for sure.
It sort of makes you wonder, doesn't it? What other seemingly minor imbalances, maybe things we don't even notice day to day, could be having bigger health impacts on our pets down the road? Definitely something to think about. Thanks so much for breaking all this down today.
My pleasure. It's an important topic.